Okay, coming to shoulder joint. In shoulder joint, we will first see the muscles, origin and insertion of the muscles around the shoulder joint. Then we will see the axilla, boundaries of axilla, axillary lymph nodes, and then we will see axillary artery, axillary sheath, and then the brachial plexus in detail. We will take brachial plexus for about 20 to 25 minutes, and then we will see the nerve injuries involving the brachial plexus, and then I will discuss about fracture of clavicle and fracture of shaft of humerus and neck of humerus. So just to get you familiar of an x-ray, let us see this. This is an x-ray of right shoulder joint. Here in this you can see now, just to make familiar you let me just tell you this. In if an examiner asks you the anterior and posterior rib shadow in this x-ray, many of you will mark that these are the anterior ribs, these are the anterior ribs, but see, this is not the case. Anterior ribs are these, anterior ribs are these. Can you see these shadows? These are anterior ribs. This is first rib, okay, and these are posterior ribs coming from vertebra. These are posterior ribs, okay. We will be discussing x-ray in detail when I will discuss about fracture of clavicle and fracture of neck of humerus. Just to tell you, on an x-ray, the things which you see black and the things which you see white, just remember this chain. Ear will be most black in an x-ray, then fat will become less black, and bone will be most white. Again, see this, see, this is lung shadow, okay, lung shadow. So here you can see ear, okay, ear, all ear spaces are black in color, okay. Again, here you can see this is something less dark or less black. So if you trace this margin, this is shadow of scapula, okay, this is shadow of scapula, okay. So coming to this picture, in exam you will be given this picture and you will be asked the diagnosis. So, or they may ask you the level of spine at which the injury is there, okay. So first see the right arm of this boy, this child. It is flexed at elbow, and it is also flexed at wrist. It is normal in position at wrist, it is flexed at elbow, okay. Now see, it's his left arm. If you see this, elbow is extended and wrist is flexed. Also, can you see his elbow? His elbow has become lateral. Elbow should be posterior in a normal anatomical position, is lateral. So there should have been a medial rotation of the arm, okay. So a medial rotation of the arm. Now remember these three things. The fourth thing is his arm is adducted. It is adducted, okay. So remember these four things. Now see this question. In this question I will be marking the important points. The boy collides, then no x-ray, no fracture on x-ray, arm was medially rotated and forearm was pronated following a triceps. So first you have to think what injury could be there, okay. So this is a typical presentation of Erbs palsy. Erbs palsy. Okay, now I will be discussing Erbs palsy in this with these points. Okay, it will be covering whole of the Erbs palsy and axillary nerve and musculocutaneous nerve basically. Then I will also tell you how to remember all these. Okay, first see where the Erbs palsy, the point of Erbs palsy is. Now to remember Erbs palsy, just remember these 5 points: the point of Erbs palsy, then the root value of Erbs palsy, what will be the causes or the mechanism of Erbs palsy, then the movements or the muscles that are involved, then sensations lost. Okay, these 5 points, if you remember only these 5 points, then you can remember whole of Erbs palsy. Okay, so first see this diagram. In this diagram, see here, the point of Erbs palsy is this one, that is superior trunk, and 2 things above it, 2 things lateral to the superior trunk, and 2 things down the superior trunk. Okay, and therefore the root value of Erbs palsy is C5 and C6. Okay, so just remember these 2 points: superior trunk is involved in Erbs palsy, and C5 and C6 is the root value. Okay, so now remember these. Superior trunk, and then here the C5 and C6 anterior rami of spinal nerves, then the superior trunk and 2 nerves arising from the superior trunk, and then the anterior and posterior division of the superior trunk. This is the Erbs point, this is the meeting point of these 6 things. Okay, and so these 2 nerves that are arising from superior trunk are nerve to subclavius and suprascapular nerve. Nerve to subclavius supplies subclavius muscle, and suprascapular nerve going through the suprascapular notch, which is converted into suprascapular canal by a suprascapular ligament, and suprascapular nerve passes within the suprascapular canal, and suprascapular artery passes outside the suprascapular canal. This is the point which you have to remember, because this has been asked as a question in your exams. So suprascapular nerve supplies supraspinatus and infraspinatus. Okay, supraspinatus and infraspinatus. Okay, so these 2 nerves are also paralyzed in case of Erbs palsy. Okay, now just remember a bullet point here, that any muscle which has been paralyzed, which is paralyzed in Erbs palsy, should have its root value of its root value should be C5 to C6. Okay, so let us discuss the muscles paralyzed in Erbs palsy. Again, coming to this question, injury at Erbs point. Okay, injury at Erbs point, this is correct. In this question they have asked false options. Okay, now this is a question from Erbs. Okay, lesion of C5 and C6 was present, this is also true. Erbs point is root value is C5 to C6. Median ulnar nerves are affected. I will be discussing this point in last. Supraspinatus and biceps are paralyzed. I told you supraspinatus is paralyzed, also infraspinatus is also paralyzed. Okay, biceps are paralyzed. Now see, what is the function of biceps? Flexion at forearm. Okay, so my forearm is extended, therefore biceps should be paralyzed. Okay, so biceps is paralyzed, supraspinatus is also paralyzed. Remember that supraspinatus the function of supraspinatus is to initiate the abduction. The main abductor of shoulder joint is deltoid, but to initiate the abduction at shoulder joint, supraspinatus is there to act. Okay. To be more precise, supraspinatus causes initial 15 degree of abduction at shoulder joint. So this option is also correct. Sensations intact. Now coming to axillary nerve, let me tell you how a spinal nerve forms. Suppose this is a vertebral canal, then within it lies vertebral canal, then within it lies spinal cord, and then from there arises posterior root and the anterior root of a spinal nerve. This is a cut section or transverse section of spinal cord, and I am seeing from above. Okay, so this is posterior root and this is anterior root. These two combine to form a short spinal nerve. Okay, now this spinal nerve again divides into anterior rami and a posterior rami. Posterior rami goes and supply muscles of back and sensory supply of back. The anterior rami of C5 to T1 forms brachial plexus. Okay, so brachial plexus root value is C5 to T1. We are done with spinal nerve. Coming to sensations, option E. Now see axillary nerve. Again I am drawing a cut section of humerus and I am seeing from above axillary nerve. It comes from here. Axillary nerve is a branch of posterior cord, and if I tell you that axillary nerve is involved in Erbs palsy, so it should have its root value C5 and C6. Therefore root value of axillary nerve is C5 and C6. Root value of nerve to subclavius is C5 to C6. Root value of suprascapular nerve again is C5 to C6. Okay, so axillary nerve divides into two parts, anterior and posterior division. The posterior division supplying deltoid muscle gives a branch lower lateral cutaneous nerve of arm. Okay, lower lateral cutaneous nerve of arm. Again now this axillary nerve supply deltoid, and remember that axillary nerve, the posterior division of axillary nerve supply teres minor also. Okay, so posterior division also supply teres minor. These posterior anterior division are also called, anterior division is also called deep branch, and posterior division is also called superficial branch. Okay, so anterior of the deep branch covers round the humerus and supplies deltoid, but superficial or the posterior division also supply teres minor and also give upper lateral cutaneous nerve of arm. Therefore when axillary nerve is paralyzed, upper lateral cutaneous nerve of arm is also paralyzed. Sorry, it's not lower lateral cutaneous nerve, it's upper lateral cutaneous nerve of arm. Okay, so upper lateral cutaneous nerve of arm is also paralyzed, and the area it supplies is lower part of deltoid. So lower part of deltoid is also called as regimental base region. Okay, so regimental base region area is the sensory supply is lost at that area. Okay, so sensations are not intact. This option is false in this question. Okay, now brachioradialis intact. See, the function of brachioradialis is to get the forearm in mid prone position from the fully prone or fully supinated position. You getting my point? From if my forearm is fully supinated, then brachioradialis will get it in the mid prone position, and if it is fully pronated, again it will get it in mid prone position. But in Erbs palsy, my forearm is fully pronated, therefore brachioradialis is also not intact. So these two options are wrong. Come to this option, option C. See, median and ulnar nerves if affected, the flexion at the wrist joint and flexion at the interphalangeal joints will be lost, but this is not the case in Erbs palsy. Therefore median ulnar nerves are not affected in Erbs palsy. Okay, therefore option C is also wrong. See, median ulnar nerves cause median kilohand and ulnar kilohand. I will be discussing these two nerves in brachial plexus. Okay, therefore this is all about axillary nerve and the sensations lost in the Erbs palsy. Coming to lateral musculocutaneous nerve of arm. Musculocutaneous nerve, as the name suggests, it is also supplying muscles, but it is also applying some cutaneous, it also has some cutaneous supply. Therefore flexor compartment of arm which has three muscles, brachialis and biceps and brachioradialis. So therefore how will you remember? BBC, brachioradialis, brachialis and coracobrachialis. This will be supplied by musculocutaneous nerve. After supplying these three muscles, musculocutaneous nerve converted into a cutaneous nerve and supply lateral part of forearm. Okay, musculocutaneous nerve supply lateral part of forearm. Again to repeat, musculocutaneous nerve supply coracobrachialis, brachialis and biceps. So to remember, it is the mnemonic is BBC, brachialis, biceps and coracobrachialis. Then it passes between brachialis and biceps, and then it continues as lateral cutaneous nerve of forearm. Okay, so when the nerve is paralyzed, the sensations over the lateral part of forearm is lost, and this question has been asked as a in your exams previously. This is all about musculocutaneous nerve. The causes or the mechanism of injury of Erbs palsy. See this diagram also. The Erbs point here should lie. Remember that trunks always lie behind the clavicle. Okay, trunks of the brachial plexus lie behind the clavicle. Therefore, the Erbs point will be here. Erbs point will be here. Okay. Coming to the causes, we are done with Erbs point, then root value, then movements lost. I will be let me revise movements that are lost. See, the my arm is adducted, therefore the abduction movement at the shoulder is lost, therefore deltoid function is lost, therefore axillary nerve is paralyzed, and therefore axillary nerve root value is C5 to C6. Okay, my forearm is extended, therefore musculocutaneous nerve is paralyzed, and therefore the musculocutaneous nerve, if paralyzed, the root value of musculocutaneous nerve should be C5 to C6, but also musculocutaneous nerve also has root value C7, therefore the proper root value of musculocutaneous nerve is C5, C6 and C7. Okay, sensations lost I have told you. Coming to causes, now see, the two causes of the Erbs palsy are either there is the injury in during delivery or during as the it was given in the question, during a riding or a trauma. Okay, so suppose a force is acting on the shoulder and The injury is like this. When the position is like this, okay, so there is increased distance between head and the shoulder due to that force acting on the shoulder. Okay, therefore when the distance between head and the shoulder increases, the upper trunk gets stretched and there is injury called as Erbs palsy. Okay, so the injury could be due to riding or during childbirth, difficult childbirth. These are the two causes of Erbs palsy, and I have told you how to remember. Just remember superior trunk is involved and C5 and C6 is the root value. You will remember all other things. Now remember that uh, the typical deformity that is formed in the Erbs palsy is known as policeman tip deformity or waiter's tip deformity. Okay, so the muscles that are the muscle functions that are lost in the Erbs palsy are the mnemonic is don't be sorry, treat it. So D is deltoid, and B is brachialis, biceps and brachioradialis. S is supraspinatus, supinator. T is teres major and teres minor. I is infraspinatus. Okay, these muscles are paralyzed in Erbs palsy. This is all about Erbs palsy. Now coming to brachial plexus.